Hello,
Start.
everybody. Thank you so much for today. I'm Hosna Salmani. I will talk about blockchain technology in patient-centered care. What I want to cover in this presentation is the patient-centered care, blockchain technology in healthcare, challenges and solutions that we might face, and mobile health and remote monitoring that is one of the categories of patient-centered care, accessing and sharing health data, use cases, and potential impact of blockchain in healthcare, and then the summary of what I talked to you. Introduction. As we all know that traditionally the data has centered around the clinician and also organization, institution, and hospital. And we can for example, face several problems like interacting with several organizations that we should, for example, for there is a need, we shift to patient-centered care system. And these systems can enable patients to interact with health professionals and also get involved in their own care and manage themselves. And at the end, they can face, for example, improve the healthcare, and then it lead to greater engagement, experiences, improved outcomes, and also increased satisfaction. So, what is patient-centered care? So, it is a strategy that can realize the goal of value-based care. It's the part of value-based care that's nowadays it's in trend that we should shift into the value-based care, and we can see the increased knowledge and skills of people and making patient a part of decision-making process. That this is, for example, satisfy them to collaborate and to, for example, make decision for us. And this is the effort by patients and their families and providers to achieve the better healthcare outcomes. And then we can see the improved quality of care. So why this shift is very important? Because it's centered around the patient experiences, and patients can involve in their treatment and their, for example, procedure, and they can, for example, involve into the treatment journey, and this can, for example, directly associated with the, for example, reimbursement for healthcare provider. And the second one is advocating population health, and this can also provide for us the value-based care, and then reducing cost, because, for example, if we consider blockchain, at the first level, we can see the high level of cost, but at the end, because all of them, for example, provider and patient connected together, and they can, for example, access the patient's information anywhere and anytime that they need, we can see the reducing cost and improving quality of care. So, what patients want in digital health tool? So they want to have data resources. They want to learn, and they want to achieve cost saving. They want to, for example, ask the right question from the providers. And they want to, for example, improve the timely access to care, and because it's very important for them, and they want to communicate better between healthcare provider, nurses, and who specialists in, for example, if we consider chronic care, the patient should always come to the hospital, and they get, for example, the right treatment, and this is helpful. This helps for us, for them, that for example, they communicate better. So I want to talk about blockchain technology and how this technology can shift the patient-centric care into better care and to better improvement for healthcare and also patients. So as we know, blockchain refers to an immutable distributed digital ledger, and that, for example, logs data entries is a decentralized manner, because we don't need for example, third party, and because all of the information stored in centralized ways, and we can after that see the security and privacy increase. And this blockchain has emerged as a transformative force that we can, for example, provide a new possibility for enhancing patient-centered care. So it can provide decentralized and secure solution for healthcare data. This data is very important. For example, the uh, uh, demographic data is very important for patients. That this may, for example, or some malware will be damaged. That's why we need to have blockchain in healthcare. And we might face, for example, the critical issues of data security and ownership. And this can help by, for example, increasing security and also integrating data together. And the patient information can be securely stored, accessed, and also shared, and then can empower patients to manage their own care. That also we can focus on data integrity and confidentiality. So in this technology, we can see myriad of benefits in healthcare, specifically in healthcare industry, because we can see enhanced transparency and security. That is very important. We can, because we always see the security and confidentiality challenges in, for example, developing a system or application. And then we can see improved data integrity, robust privacy protection, ensured access control, data logging, and also data versioning. That's because we can see, for example, who access to the data, who entered the data, and we can see the time of the last access data by, for example, someone that entered to the blockchain network. That's very, very important for us to see the changes that was done by who. So blockchain and that can facilitate secure storage and also transfer of health information between the patient and healthcare provided, because we are in a network, in a big network, and we can see that, for example, all of the patients or all of the healthcare providers can access the data that they need. This is the important role for blockchain that we can put and adopt in our healthcare systems. So, how can, for example, see the solution for the blockchain, and how can, for example, we overcome the challenges that we might face? There are several applications and systems that they have developed, and one of them is a MediLinker, that this can demonstrate the practical utility of this emerging technology, and this can overcome the common obstacle, as I told you, with the integrating blockchain into a clinical environment. This is very important, and we can also see that this system can overcome the privacy concern, and with, for example, having the regulatory compliance, we can, for example, face that this system can be improved in the future. So we should see that the collaboration among stakeholders is very important, and that this can help us to have the potential of blockchain technology in healthcare systems. So I was talking about a mobile application or remote monitoring. That with this application or system, because it's we can see that these are the categories of patient-centered care, we can record data and send it to the healthcare providers. And we can, for example, there is no matter for distance, because all data are available. It's available for example, who needs. And at the end, the patient can monitor their own care and treat, and they, for example, follow the treatment. So how, for example, the application work in blockchain? Because the healthcare industry is like a private blockchain network, and the data in the network were secure and also resistant to the manipulation of, for example, the human, and the data was accessible and also controlled by the patient too. So the applications can has, for example, three layers. One of them is storage layer, another one is data management, and another one is a data usage layer that altogether can, for example, improve the security and the functionality of the information that we might enter and log into the network, and this can help, for example, integrating them and it let the physician, for example, collaborate. So in this case, we may have the smart contract. The smart contract, what is smart contract? This can help us to monitoring devices securely, and these smart contracts verify and monitor the blockchain activity and enable real-time patient monitoring, because it's very important. For example, the real-time notification should be sent to the provider, and the real-time updates is very important because because of the safe care at home, and the patient can access data every time that they need. So challenges in mobile health and remote monitoring, that's security challenges and concern we might have. But the data, because it is very sensitive, and the blockchain can control this, and that's why for example, data is completely secure because the data spread into the network and in the decentralized way. So another one is accessing and sharing health data, and this is important, and that, for example, medical records, for example, can be difficult to access. You know that each organization may have the specific data, and there is no standard for transferring the data into another organization. So this can help that the patient or physician can fully access with a secure, for example, health data, and they can, for example, see their history. You know, this in this picture that there is like a blockchain and network, and the doctor and, for example, physician, I mean, doctor and the patient, and also the, for example, laboratory assistant can connect together, and they can, for example, enter with a specific identification in blockchain, and that's why they can be, for example, recognized if, for example, there is something. The ID means, I mean, the hash in blockchain. If, for example, there is any difference, we can follow the hash, and we can see the, for example, who wants to interfere in our networks. Another use cases in the sharing data is one of them is MedBlock. MedBlock is a blockchain-based information management system that can enable data access and retrieval in the distributed blockchain principle. Another one is OmniPHR. OmniPHR, there is a PHR that all PHR is personal health record or patient health record. That all that bring us all patient health record in one accessible places. You can see in this picture that there is only one. I talk about the picture that is related to the connection, and then I talked about the OmniPHR, that the all data can be collected to the one PHR, and another one is and the EMR sharing system for cancer patient, that because this system emphasizes security, availability, privacy, and also control of data access, and this can, for example, save our times. Another one is the LifePhone, that reward patient for entering data. This is the like an encouraging point for if, for example, we want to collaborate patient in our system. This is an important solution for us to provide like an encouraging participation for example, patients. And the patient location is another important health information that we can share by blockchain-based multi-level privacy-preserving location sharing scheme, that the BMPLS, and that is for telecare or telehealth medical information systems. And this is another blockchain. So at the end, this transformative potential of blockchain can the opportunity to enhance patient outcome, simplify patient access or healthcare processes, and also promote data interoperability. And this is the picture. If I want to show the full screen, that there is a blockchain-based system on mobile cloud, because you know that this part is a blockchain, and that there is several areas for patient or organization, and that they can enter and log data into the system, and this gateway is like a data storage for us, and this can, for example, transform the data to the cloud-based system, and this is like a blockchain in a decentralized storage, and all of them, this is the contracts, as I told you, smart contracts, and each of them has a e-health records with, for example, patient information, and the doctor and therapist, everyone with, for example, authorized, for example, physician can access and see the record as well. So for creating blockchain in patient-centric environment, we should set a benchmark for organization engagement. Starts at a basic level, and we should, for example, interact with the patient. We should figure out the need and the perspective of the patient, and trust patient to become a fluid traveler, and also create a blockchain system that can, for example, support the patient's need, and also we can, after that, reshape and revise in the healthcare environment. What I talked to you, it was related to blockchain, that it can maximize the security and accessibility. And this technology can be used in many different areas of healthcare, and can use for storing and sharing medical records and also insurance information, because it's very important, and it's like a secure information both in healthcare and also patient-centered care, like a mobile application and also remote monitoring system. I also wrote several articles. The related one is the impact of mobile health and cancer screening. Another one is we developed an application for cancer patients to manage themselves, but it's related to self-management. Thank you so much for your attention.